Oladosu. Welcome to another episode of Economy on the Street. Recently, there's been multiple cases of medical negligence. Medical negligence is said to occur when a health sector professional or a health institution fails to provide the expected standard of care, thereby causing harm to the patients. Today we're on the streets where we're going to be finding out from Nigerians if they've experienced this and what do they think is the possible solution to this.
Medical negligence is normal. It's normal in Nigeria. It's personally, if you ask about me personally, people died. A friend of mine lost his wife during birth in my presence as a result of lack of blood. The nurses at that point at the night could not know what to do. They lacked blood. They lacked blood at that time. Before they sought for blood and do 1 or 2 oxygen, the lady is gone.
You and I know that it's a very unfortunate situation. Our healthcare centers don't have medicines. You hardly find paracetamol in a healthcare center. It's very unfortunate. It's a sad thing to say. Well, it sounds crazy, but that's the truth. You know what I'm saying? If you can't find paracetamol, how much more antivenom? So it's a sad situation. I just hope that the government will take a cue from this one and see what they can do to help the people. And Nigerians are not asking for too much. They are asking for just very few things. Basic health care, food, transport, and the rest of it. It's not too much to ask. If you give us all these things, you can rule for as long as beer in Cameroon. I guess you know about that. We don't care about who rules. Actually, it's a sad situation. This girl would have survived, but just because we don't have the basic things we need to have in our healthcare centers. Do we even have healthcare centers? What is the condition of the healthcare centers we're talking about? That is a question. You know what I'm saying?
Not only the snake bite or whatever, even malaria. There are some medical centers that don't have malaria drugs. I've gotten experience with my late daughter February last year. I took her to FMC in Maraba. When we got there were no drugs for her. Somebody I just rushed. I have to carry that girl sick. I was running to go and look for drugs. I was like,
the hospitals are not very proactive when it comes to attending to patients, because I've experienced that before. You go to the hospital, before they can attend to you, it takes a very long time. But if he's a politician or someone with money, before you know it, if it's
our healthcare today, they are not really trying. They need to facilitate our healthcare. Like they need to equip our hospital today so much that all those things should be available.
Yes, I have experienced that before. You get, and this is something that I wouldn't want to talk about in a hurry. Yeah, that was in a Nigerian hospital when my son was a preterm, 7 months. So there was the preterm of my wife, and the boy was brought out. So before they could attend to me, I have to pay for oxygen. I have to. If not, that baby will not be taken to the incubator. So I'm saying it out of experience.
There are some medical facilities like primary health care centers that the government had funded, but continuity is what we lack most times. You go to an hospital, the government has provided beds and everything. Okay, what about the people to manage it? Nowhere to be found. Let's assume a doctor is supposed to attend to 20 people and the doctor ends up attending to 300 people. You can't expect the same output.
These are what Nigerians have to say. Thank you for watching today's episode. See you next time.